Enteral medications are broken down within the GI tract and absorbed into the bloodstream, where they are carried directly to the liver, allowing the liver to act on the medication before it is distributed. This is called the first pass effect. The degree varies, but any drug not given by some form of injection will always have a bioavailability of less than 100%. Some substances, such as insulin, are broken down in the GI tract into a non-therapeutic substance and therefore cannot be given enterally. During first pass, the liver chemically processes the drug into active and inactive metabolites. The active metabolites of some drugs cause prolonged duration of activity. For instance, the effects of diazepam can last for weeks or months. The ratio of active and inactive metabolites affect the bioavailability of the drug. This is the primary reason that enteral medications of the same dose have less effect than if given parenterally. For example, morphine given as tablets requires a significantly higher dose for effective analgesia than morphine given intravenously or by intramuscular injections. The first pass effect may be low, moderate, or high, depending on the drug. Absorption of enteral medications is also affected by factors in the GI tract itself. Enteric-coated medications may remain in the stomach long enough for the coating to dissolve if taken with a large volume of food. Acid-sensitive drugs taken on an empty stomach may be rendered ineffective. Gastric acids affect absorption, and little is known regarding the effects of either the short-term acid reducers, such as ranitidine, Zantac, and famotidine, Pepcid, or the longer-acting proton pump inhibitors, such as omeprazole, Prilosec. The rate of intestinal motility varies significantly from individual to individual and is affected by activity, age, diet, overall health, and medications that slow or stimulate intestinal function. Biorhythms affect both intestinal motility and gastric acid levels, so the time of day when the medication is administered can have direct effects on drug absorption and drug tolerance. People who receive chemotherapeutic drugs in the morning often report less GI side effects than if they receive them in the afternoon. Another factor that affects medication absorption is age. The aging process slows intestinal motility and can also decrease absorption. This may be further complicated by the fact that aging can increase or decrease sensitivity to various chemical substances. And the chemical attributes of the medication itself affect the rate of absorption. These include acid sensitivity and interactions with foods that may increase, decrease, or alter their effects. The chemical components of medications can be affected by the presence of other medications. The more medications an individual is receiving, the greater the likelihood of an adverse interaction, such as a chemical change in the drug or drugs that increases or decreases the rate of absorption. Alterations to the bowel, such as bariatric surgery and bowel resection, decrease the intestinal surface area, directly decreasing the rate of absorption. Finally, vigorous activity decreases absorption by shunting blood away from the GI tract to support the heart and muscles. Regular participation in sports or training activities may require adjustment in the time of administration of medications. Now we'll focus on drugs given by parenteral routes. These medications don't experience the first pass effect and are 100% available as they enter the bloodstream.